Hello. The intrauterine contraceptives, or IUCs, commonly known as the coil, are long-acting reversible contraceptives, or LARCs, which provide long-term contraception without you having to take tablets on a daily basis. Two examples of the coil are the intrauterine device, or copper coil, and the intrauterine system, or IUS. The most commonly used IUS is the Mirena coil. These are small T-shaped devices that are placed inside your womb. The main difference is that the IUD contains copper and the IUS releases the hormone progesterone. Both of these coils are inserted into the womb in the same way, and this video will tell you all about the procedure. In general, you will need to have an appointment at your GP surgery or sexual health clinic to discuss contraceptive options. Once you and your healthcare professional have decided that the coil will be suitable, you will need to make an appointment to have the coil inserted. The appointment normally takes between 10 and 15 minutes. Some women find that taking painkillers shortly before having the coil fitted helps, as it can feel uncomfortable. At your appointment, you will be called into a treatment room and asked to take off the bottom half of your clothing and your pants. You will need to lie on the bed, but you will be given a sheet to cover yourself with. Once you are ready, the doctor or nurse will come in. They will ask you to bend your knees and drop your legs out to the side. They will use a speculum to open your vagina. A speculum is a plastic or metal tube which is slowly opened to show the neck of your womb, also known as the cervix. It is the same as when you have a smear. The speculum can feel cold and a little uncomfortable, but should not be painful. The doctor or nurse can then check the position of your cervix. You may be given a local anaesthetic around your cervix to make the procedure more comfortable. A thin tube containing the coil is then passed gently through the opening in the cervix and into the womb, where it is released. It has 1 or 2 threads at the bottom, which hang through the opening of the womb and into the top of the vagina. You cannot usually feel these threads, but they provide an easy way for your GP or nurse to check the coil is in the correct place. Once the coil is in place, the speculum is removed and you can get dressed. A coil check will take place 3 to 6 weeks after the coil is fitted. Your GP or nurse will also teach you how to check your coil is in place by feeling for the threads. Complications after having the coil fitted are rare. Fewer than 1 in 100 women will develop a pelvic infection shortly after fitting. In fewer than 1 in 1,000 women, the coil can make a hole in the womb at the time of insertion, which causes lower tummy pain. Talk to your GP or nurse if you feel a lot of pain after the coil has been fitted, as it needs to be treated immediately. Wearing a tampon or having sex will not make the coil fall out, but very occasionally the body can push the coil out. This is most likely to happen soon after fitting. If you are worried, talk to your healthcare professional to be certain that you still have contraception. Please visit your GP or local sexual health centre for more information about having a coil.